most of our staff that we hired here in New Britain lives in New Britain. Okay, they're from the town. They grew up here. They speak Spanish. They speak Polish. We have staff always on staff that speaks both languages. So it's important for us to be able to connect to the community like that. That's what we're trying to do, is have a compassionate, caring, authentic touch point with these patients, so that we really take care of them when they're here. And I think I feel like that's a missing component in healthcare. Most people in this profession are here because they want to take care of people, but the systems that they're in, or the environment that's created within those systems, comes off, with a different result, or a different perception for the patient. And so, to me, that was a very important piece of this whole thing.
So it's always important to make sure that you have a critical care facility somewhere in the city of New Britain. We are a city of over 75,000 residents, and people do have their needs, whether it be from a broken ankle to a cough to maybe a sinus infection. There's a lot of things happening in the community that need to be addressed. We are very lucky. We do have a lot of wonderful care facilities, but we are absolutely thrilled to welcome AFC Urgent Care to the city of New Britain. And they'll be a great benefit, a great fit for our very young community. We do have a lot of children and families in New Britain, a lot of kids that get sick every once in a while, sometimes all too often. So to have another facility for them to be able to come to with ease of use and a very easy location to get to as well is going to be imperative to the overall health of our community.
This potentially, I think, lends itself to a tremendous reuse of this site, probably at a higher and best use, no question about it, because you have a plaza across the street that kind of serves a population in the neighborhoods in the back there that's probably more challenged population economically. So some of the storefronts in here, like Your Eyes across the street, primarily serves that population through Medicare and Medicaid reimbursement, stuff like that. So I think you're positioned quite well here, given the senior housing across the street and the walkability for all those people to come to a place closer than a hospital or other places that are in the region. So I think it'll do quite well.
We have the digital X-ray machine, and then that can benefit it. We can tell quickly the difference between the spleen and a subtle fracture that require the more orthopedic care. Definitely the digital X-ray is going to add up the value. And also plus the X, not only those level, but also for the chest X-ray to differentiate between the walking pneumonia and just the simple bronchitis.
As you can see here right behind me, this is a major thoroughfare through the city of New Britain. It is 8th Main Street. We have probably our biggest retail mall generally right behind us. And as far as we're concerned, this is a godsend. This will be absolutely a great asset for the city of New Britain, and I think I'll serve this community extremely well.
The most important thing is as medicine changes, as healthcare changes in the United States, institutions like this are going to be more significant. We've got to relieve the unnecessary trips to the ER. And people, especially people of lower income and maybe lower education, that's their immediate response is the ER. And we need to actually triage those type of I've got a sore throat to a AFC urgent care center, because that's where they belong. And it'll be very good for all of us, everybody who's supporting health.